Hello everyone. Today I'll be discussing in brief about the topic nasal myiasis. Maggots in nose is also known as nasal myiasis, penis or scoliosis. Maggots in nose are commonly seen in elderly patients with slight predominance in females. It is common in low economic classes due to their poor nasal hygiene. Most important family for causing nasal myiasis is Calliphoridae family, which includes Calliphora, Lucilia, and Chrysomia genera. Maggots are the larval form of flies, particularly of genus Chrysomia, and the most common flies which is responsible for nasal myiasis is Chrysomia vagina, and other flies which are responsible for nasal myiasis are Chrysomia megacephala and Chrysomia faunus. Maggot is a larval form of fly. It is attracted by a foul-smelling nasal discharge, which is seen in case of atrophic rhinitis, nasal syphilis and leprosy, purulent sinusitis, post-radiotherapy in carcinoma of maxilla. Fly lay about 200 eggs at a time, which within 24 hours hatch into a larva. Larva causes destruction of nose, nasopharynx, paranasal sinuses, soft tissue of face, palate and eyeball. Cases are seen mostly between August and October. This shows the life cycle of Chrysomia, in which we can see an adult housefly which lays egg, and from that egg the larval form of the housefly is developed. From the larval form, under favorable condition, it develops into the pupa, and later on the pupa develop into a adult housefly, and in this way the cycle will be repeated. In this picture we can see a adult housefly and a maggot form of housefly. This is a picture showing number of maggots which are present inside the nasal cavity of a patient. This is also the picture which shows the maggots inside the nasal cavity of patient. Now moving on to clinical features. Maggots in the nasal cavity will cause intense nasal irritation, sneezing, lacrimation and headache, and there may be also nasal obstruction, foul smelling nasal discharge, blood stained nasal discharge. Patient will have a facial pain, puffy eye and lips, and patient may also complain about the crawling sensation inside the nasal cavity, and maggots may also come out from the nose. Later on, maggots may also develop fistula on the palate, and death can also occur from this disease due to development of the meningitis. Now, moving on to treatment. The treatment is removal of maggots with nasal speculum and forceps. Speculum can be used for the visualization and forceps can be used for the removal of the maggot. Endoscopic removal of the maggots can also be done with forceps. Nasal irrigation can be done with diluted chloroform or turpentine oil, which are irritant to the maggots. Nasal dousing can be done with a normal saline 4 times a day to remove slough, crust or dead maggots from the nasal cavity. We can also use liquid paraffin for lubrication of the nasal cavity, and patients should be isolated from the contact of the flies by using a mosquito nets. Antibiotics can be used to control the secondary infection, and the patient will have to maintain the nasal hygiene. In this picture, we can see the process of removing the nasal maggots by using forceps and nasal speculum. In this picture, we can see the maggots after removal from the nasal cavity. Thank you for watching.